My name is Chikodi Ohaya. I'm a first-generation Nigerian immigrant from Santa Clarita, California. I'm a medical student at the University of Arizona College of Medicine, Phoenix, and together we can elevate med. Escaping religious persecution in Nigeria gave me a strong spirit of service and led me to a career in medicine. My mother had a convenience store that was a safe haven for others. After acts of violence, villagers would come in for medication, and I often helped my mom as she cared for them by giving them medication or by applying aloe vera to their burns. Unfortunately, this put our family in the crosshairs of local extremists. In the dead of the night, my siblings and I woke up to find our homes being engulfed in flames. I'll never forget the stinging sensation in my eyes and the smell of burnt hairs as the flames ate through the walls and our bedroom filled with smoke. My mother hurriedly threw us from the second floor window to a crowd below, and we escaped in the back of a pickup truck. These moments sowed seeds of resilience and inspired me to pursue a career in healthcare, through which I aspire to be a beacon of hope and healing. I see dermatology as a powerful avenue to create change in clinics, classrooms, and communities. My passion for dermatology, particularly burn care, comes from seeing many people in my community either burned alive or suffer from long-term complications. This has fueled my dedication to improving dermatologic care and education for Black and Brown patients. Through the guiding coalition of anti-racist transformation, I created a scholarly project at our institution to both assess and improve the representation of Black skin in our lectures. Beyond academia, I'm expanding access to dermatologic care in community settings. With the Stanford grant, I surveyed Black and Brown men in barbershops about their hair and skin health. These men saw their barbers more frequently than their doctors and were receptive of health education in that setting. Inspired by this, I aim to develop educational materials on dermatologic conditions for barbershops and hair salons, using my background in education and journalism to meet people in minority communities where they are. I'm passionate about community advocacy and hope to use my talents to continue to impact entire populations. As a change agent, I tackled systemic healthcare barriers by creating a rideshare partnership with Lyft and the Coalition of Blacks Against Cancer that I call Lift Every Voice. I secured grant sponsorship from Lyft and enhanced transportation access to health appointments for Black cancer patients in Arizona. I also co-created the Robin Hood of PPE during the pandemic to collect over 500,000 medical supplies and redistribute thousands of these to safety net clinics. As a director of supply and distribution, I helped lead our team to secure an $18,000 grant and expand our efforts locally, regionally, and even internationally. Beyond direct advocacy, I aim to be a physician journalist who educates and empowers underrepresented communities. My passion for storytelling led me to pursue a master's in journalism at Stanford, where I've taken a data-driven approach to amplify critical issues in medicine. I hope to build on this and leverage my background as a former teacher and my passion for education. My admiration for ElevateMeD has deepened over the years. While volunteering at Explosion of a Dream in 2021, I observed ElevateMeD's role as more than the mentorship network, but instead as a coalition of community champions committed to empowering others. I've attended every Explosion of a Dream since then and have had the opportunity to learn from the scholars like Marcus Childs and Abby Solorio, while soaking up wisdom from Dr. Wayne Franklin and others. My husband, Iwoma's journey as an ElevateMeD scholar has further granted me an insider's perspective of the program's impact. Witnessing his development propelled by Doug Stevenson's storytelling and Alicia Maciel's career coaching, I've seen how ElevateMeD nurtures and molds leaders. This training would empower me to mentor future physician leaders, enrich my peers in my cohort, and continue my advocacy for underserved communities and unheard voices. Thank you to the generous donors and supporters of ElevateMeD. Your commitment not only fuels the aspiration of future physicians, but also directly contributes to transforming healthcare for underserved communities. As a hopeful beneficiary of your kindness, I'm inspired to not only pursue excellence in medicine, but to also embody the values of ElevateMeD by advocating for those without a voice. Your investment is more important now than ever and extends beyond financial assistance and is a vital part of nurturing a diverse medical workforce poised to tackle the complexities of global health disparity. Thank you for believing in us, for empowering our journey, and for being the backbone of this transformative mission.